Canada really wants to fuel innovation, we need to avoid something that is going to be more problematic than the global economic downturn we saw through 08, 09, 2010, so on and so forth. And that's the challenge of healthcare transformation. Forecasts are right now that we will be spending as a nation almost $250 billion annually on the healthcare front. Well, if we're going to be spending $250 billion by 2020 on healthcare, why don't we do a pro forma view of Canada within that time frame as to what's left to spend the money on in terms of all the other social services that are fundamentally important? Because my argument would be, if we do a pro forma and say, okay, here's what we have left after we spend on healthcare, how are we going to spend that money effectively? I think it would scare the dickens out of people. And this is a problem that's not unique to Canada. This is a problem that's common all over the world. We're all going to have to answer this same challenge. If Canada, by making smart investments in technology innovation and some of the efficiencies that technology can drive, can break what people now see as an inevitable paradigm, and have more dollars available for investments other than healthcare, by doing healthcare much more effectively and much more efficiently, that is going to support innovation and the competitiveness of our society and the welfare, the lifestyles of our citizens. And to me, that's a cause worth getting behind. We've said to ourselves, well, what can we do to help out healthcare? Well, let's first ensure that the digitization of our society includes healthcare. You have to make sure that the content within healthcare is digital. Let's get that digitalization done. Let's make sure that we can store it efficiently and effectively. Let's make sure that that patient information is secure. Let's make sure that we can integrate data networks so that they're interoperable across the healthcare continuum so that we don't make mistakes. If we can supplant paper-based records with electronic medical records, we will drive better patient outcomes for less money spent. And let's do the same thing within our hospital institutions as well. And let's weave that all together then in terms of personal health information put in the hands of consumers so that they're empowered and they can be jointly responsible for taking care of their own health and the health of their families. Let's enable the docs to leverage the full advent of the digital society that we all live in. Using things like high-definition video conferencing, allow a patient and a nurse to be in a remote location, connecting with a doctor within an urban center and doing a diagnostic, doing an aftercare without the cost and expense of the travel, and what it does to the efficiency of the specialist in terms of how many patients that they can see, on a given day versus having to see them all physically rather than just virtually. It's a 20-fold productivity increase. Take that technology from a clinic in a remote area and put it into someone's home in the rural confines. And now you're taking a future-friendly home and you're making it into a future-friendly hospital room where we may have hospital rooms that are too congested. Well, with broadband technology, we can make that particular home a virtual hospital bed, if you will, and again, put that particular patient online, particularly if you're trying to tackle some of the major drags on the economics of healthcare, such as chronic disease management. I've seen so many people experience a less than optimized outcome from the healthcare system. I see it as a situation where the challenge is getting bigger, not smaller, for the reasons that I've just articulated. I don't want to live in a world where the economic appetite for healthcare crowds out everything else that we wanted to be put on the planet for in the first place, and yet we're heading for that particular outcome, and it scares me. I do believe that technology innovation can drive a transformation in healthcare where we can simultaneously improve patient outcomes and reduce the cost of healthcare. In fact, I believe in the self-actualized state of innovation and technology where we can drive a shift from the remediation of disease to the prevention of disease. And of course, that's the most cost efficient. And if we can do that well, we'll have a lot more money left to spend on infrastructure, education, the enablement of our youth constituency, and the like. And also answering some of our social challenges. If we can make sure that there's money to be invested there because it hasn't been completely consumed by healthcare, I think we'll drive a lot of innovation, and I think we'll do very well on a differentiated basis.